You're welcome today to our webinar from the POM platform, that's Carlo, the mentorship platform. And today we're going to be focusing on a very important topic which many people are interested to learn from experience of other colleagues who've gone through that. So the topic for today is the UK public health training application. So the process, the stages, all you need to know, and a Q&A at the end. So if you've got any kind of question, just shoot at the end of the discussion. The panelists and the experts we've got today have got the capacity to answer the questions you've got. But before we start, we need to observe a number of housekeeping information. One of it is that you need to keep your videos and your microphone off. You are only permitted to speak when you've got a question. But if you even have any question, please keep it to the end when the guest speaker has finished speaking. Then we can ask all our questions at the same time. So if you've got any burning question, just write it down somewhere so that you don't forget about it. And if you're in a noisy environment, it would be good if you put off your microphone so that we won't have any interferences. Having said that, I welcome everyone who is participating in this call, and once say we appreciate your time to come and listen to all we've got to say. I hope at the end we're not going to bore you with the technicalities of the UK public health training application scheme. So my name is Dr. Carlo Udu, and I'm an academic clinical fellow. I'm based with the University of Liverpool. I'm going to welcome right away our speaker for today. He is Dr. Kayode Afolabi. He's a public health registrar with the School of Public Health, Northwest England, and he's a very dear colleague. So I'll call up Dr. Kayode to take over the stage. Thank you very much. Dr. Kayode, over to you.
Hello, everyone. My name is Kayode, as Carlo had introduced. So I'm just going to be giving an overview of the public health specialty training application. Can everyone hear me? Just check in before I keep talking to myself.
Yes, I can
Okay,
from
great.
my end.
Can I just get confirmation from other people?
Yes, I can also hear you.
Fantastic. So I'll give an overview and then we can go through lots of questions at the end of the presentation. It's only going to be a few slides. I'll try to make it a bit interactive so some of questions can come in between the presentation if you have any pressing questions that cannot wait till the end of the presentation. Okay. So first, just in case some people are here and are not even sure what this specialty training program is about, I'll just put a quick overview. If you're like this guy on the right side of the screen and you don't even know what it is one of the routes to becoming a consultant in public health. For those who may not be familiar with the term, if there's anybody like that, consultant is like the pinnacle of the height in a medical career, and public health is just one of the different specialties in medicine. And the focus of public health is to improve the health and well-being of a population, local population or national population. On the other hand, all the other specialties of medicine focus on improving the health of individuals, one person. So the populace is something very important in public health, and you're going to be hearing that a lot. You treat the population and not individuals. The training scheme is overseen by the Faculty of Public Health, which is part of the Royal College of Physicians. So if you complete the training and become a consultant, it means you are automatically a member of the Royal College of Physicians. And the training lasts 5 years, and it includes an MPH for 1 year that is sponsored by the Faculty of Public Health, sponsored by NHS England invariably. And it is the only specialty in medicine that is open to both people with a medicine degree and people without a degree in medicine. And that is quite rare. It's probably one of the few countries, if not the only country in the world that does that. The recruitment process is a national process, so that means everybody that applies, though the departments and the training is regional, that means throughout your training you'll be posted or you'll be based in one region of the United Kingdom, and that includes England, Wales, Northern Ireland, and Scotland. But the recruitment process is not done regionally, it's done at a national level. So everybody makes one application to one port, and then you pick your preferences. I'm going to talk about that later on in my talk. You pick preferences of which regions you prefer to go to, and then based on your performance in the application process, they post you to whichever region. So that's why it's called the national recruitment process. So quickly, if just for me to understand the different backgrounds of people I'm speaking to, so I can tailor my talk towards that and know what part of the talks to focus on. Are we all familiar with Mentimeter? Feedbacks, please.
Yeah.
No?
Okay, if you have your phones, you can just go to menti.com. Look at the top of the screen. If you type menti.com in, you'll be able to put that code in and you'll be able to answer these questions, and we can see the spread of people who are participating in this talk today. Once you're able to log in and put the code, you should see the question there and you should be able to select which group you belong to. One response coming. I'm expecting more. How many people are on the chat?
We've got 7, then you 8.
Okay, so I'm expecting. Is that including yourself? No.
Yes, that includes me. Everybody here is
Okay.
8. For
Okay, so I'm expecting 6 responses. We are waiting. So I'm assuming some people are not with us. They are with us in number, but they're not with us in body, soul, and spirit.
or
All right,
maybe they are fiddling with the Menti.
with the Menti. Is anybody having issues walking around the Mentimeter? Okay, I think we have 6 responses now. Okay, fantastic. So mostly medical graduates and one non-medical graduate. It's fine. Anyways, I'll be talking to both sides of the application process. Because I'm a medic by background, I'll probably know more about the medical routes. But if there are questions I'm not able to answer in terms of the non-medical routes, I might be able to signpost you to where to check or who to ask. Okay, thank you very much. Another poll still with Menti. Just to quickly know what's the main reason, what's the motivation for people wanting to do this public health specialty training? So again, if you didn't close the initial page where you did the first one, you should be able to just pick an answer here. If you already closed it, you might need to put that code in again and then pick which one best describes your reason for wanting to join this program. expecting 2 more responses, 1 more response now. Nobody's speaking easy workload or avoidance of clinical work. Okay. Well, speaking with my colleagues in the training at the moment, I think better social impact than clinical medicine is a very recurring reason why people decide to do this training program. Many people talk about how they're not happy or comfortable with outcomes in clinical medicine, and they believe they can do a lot more in public health and preventive medicine. If anybody is thinking easy workload or little or no stress, then I'll say you need to rethink, because it's a common thing. People say it a lot, especially people that are not into public health, but it doesn't significantly give you easy workload compared to clinical medicine. It's a different type of busy, it's a different type of stress. But if that's the reason, then you might need to rethink your choices. And then one last poll before we start to talk about the process. This is taking us directly into talking about what the application is going to be like. Has anybody heard of competition ratio before for specialty training in UK? If you have, you can unmute yourself and just say yes or what you know about the competition ratios while people are putting their polls.
Yes, I think I have seen it in a number of places, like 1:10. Like there are five, let's say 50 slots, but 1,000 people are applying for that 50 slots. So it will be like 1,000 divided by that 50. That will give you a ratio, the competition ratio.
Exactly, that's so, and they publish that for every recruitment round. That's every year they publish those numbers. So how many people applied for that specialty and how many slots are available. So they use that to calculate ratio, like you've just said. And that ratio can tell you the higher it is, that means the more difficult it is, or the more competition you have for that specialty. I'm expecting one more response. Well, it looks like people know a lot about this. Ordinarily, people would assume that specialties like surgery, obs, and gynae are, specialties like surgery, obs, and gynae, even emergency medicine, people would assume they are more competitive than public health, but it's actually one of the most competitive specialty trainings to enter. The next slide will show some numbers. So I just picked out from the most recent competition ratio. That's for the applications for 2023, those that started training last year, August. And this was what the competition ratio was like. Only 3 specialties were more competitive than public health medicine to get in. These are the numbers of spaces. So where you see 272 to 8 for community and sexual reproductive health, it means there are 8 slots and 272 people applied. For public health medicine, for that year, that's 2023 August start, there were 124 places and 1,258 applications. Quite competitive, but yeah, possible and doable, and that's exactly why we're having this talk today, to sort of guide us through the application process, know how to prepare, know what it's like. Invariably just encourage you to put in your application and put in a very good application, improving your chances of getting in. So this is what the application process looks like. It's in 3 stages. It's not very similar to all the other clinical specialties recruitment where you have to write the MSRA. For most other specialties, there's an exam called MSRA. I can't remember what the full meaning is like now, but public health training recruitment is entirely different. They have their own tailored exam. And unlike most other specialties, again, where you need to submit a portfolio to show that you have some experience and interest in that specialty, there's no portfolio submission for public health specialty training. So it's in 3 stages. The first stage is where they check eligibility of those that have applied. So there's an advert that comes out. At the end, one of the slides towards the end, I've put the link for where the advert is going to be put. They've already put some preliminary information, and application is going to open next month. So people apply within the application period. There's an eligibility check-in phase. That's the stage 1. And like I mentioned earlier, both people with medical backgrounds and non-medical backgrounds can apply. The eligibility check-in is a bit different for these two groups. I think it's only at this point where there's some differences for medical and non-medical route. Subsequently, everybody goes through the same processes through the applications, and then even in training, you're doing entirely the same things. Then the second stage is the assessment center, where you have tests. They're called psychometric tests. There's 3 of them. There's one that checks your numerical skills. There's one that checks critical thinking. And there's another one that checks your situational judgment capabilities. All these tests are virtual. They're done together in about 170 minutes, so nearly 3 hours. And the test can be done from anywhere in the world. You don't have to be in the United Kingdom to do the test. And then the third stage is the selection center, which is basically interviews. It's also done virtually. And you have panelists, usually public health consultants, interviewing you. So we'll go into details for each of these. So the first stage, the eligibility check-in. For the medical route, what they're checking, if you look at the person specifications, all these things are listed there. So they'll check to confirm you actually have a medical qualification, MBBS, MBCHB, or whatever it's called anywhere in the world. And you need to be registered with GMC and hold a license to practice. You need to have a minimum of 2 years of postgraduate medical experience. I've put an asterisk there because that 2 years is not 2 years from when you're applying, it's 2 years from the start date of the training program that you're applying for. So the next one will be starting August 2025. So that means minimum of 2 years experience by August 2025. So if you have 1 year and a few months at the moment, and it's going to be 2 years by August 2025, it means you can apply. You don't have to have 2 years before you apply. And then you need 12 months of medical experience after full registration. If you're trained in Nigeria, it just means you need to have completed your house job. And obviously, if you've worked 2 years postgraduate, it means you would have completed your house job and you would have done an extra 1 year after graduating. There's also what's called the CREST form, that Certificate of Readiness to Enter Specialty Training. It's just a form to attest that you have the competencies that you're supposed to acquire during house job. And this needs to be signed by a consultant that you have worked with for at least 3 months, 3 consecutive months in the last 3.5 years. Again, that's asterisk because it's 3.5 years by August 2025. So it means by if whatever form you're putting in for that, it needs to be signed by a consultant you have worked with between February 2022 and August 2025 for at least 3 months, and the person is able to say this person has the competencies of a foundation doctor or higher. So you can get that from any clinical practice that you have done in Nigeria, as long as it is within 3.5 years of August 2025. Any questions before I move on to non-medical route? Can everybody hear me?
Yes, we can hear you. Anyone that has a
So
question,
no questions?
yes, it's asked to keep it till the end of the presentation.
Okay,
So
fantastic.
that
That's
question
fine.
will be attended to at once.
Okay, that's great. Then on the other side, the non-medical route, as opposed to having a medical degree, you need to have a first degree, a master's degree, or PhD, or you need to be registered to practice healthcare in whatever field it is. So be it nursing, physiotherapy, as long as it's within the healthcare space and there's a regulatory body. Because for most of the healthcare degrees, it's not honors, so you're not given a first class or a 2-1. And then you need to have at least 48 months of work experience. General work experience, it doesn't have to be medical, it doesn't have to be related to public health, that 48 months to meet that criteria. So you could have worked in whatever other field, as long as you have 48 months of work experience, you are eligible. Now, the next phase is you need to have at least 24 months work experience related to population health, that's public health. And this work experience, this 24 months, which is part of the entire 48 months that I mentioned in the second bullet, sorry. So it's not 24 months aside from that 48 months. The 24 months can be included within the overall 48 months experience. I put that in bold because it is up to the applicant to explain how this work experience they are putting in is related to public health. Some people do not get past this first stage because they have not explained it properly, how their work is related to public health. Somebody could be an engineer, apply for this post, and explain properly how their role in whatever engineering is related to public health, and they get shortlisted for the next stage. And somebody that is a nurse or maybe a physiotherapist that has done some work that he or she could say this is related to public health and doesn't explain it properly, might not get shortlisted. I'll talk a little bit about the band 6 in the next slide when I'm giving an example. Band 6, so their salary scheme for other health workers apart from doctors is called AFC, Agenda for Change Salary Scheme, and they have different bands. So band 6 is one of the levels in the band. It goes from band, I think band 2, there's no longer band 1. It goes from band 2 to band 8. And so you need to be at band 6 or equivalent. Obviously, we don't use band 6 in Nigeria. You need to be able to explain how your role, the level of your role in Nigeria or wherever it is in the world, is equivalent to band 6 in the UK. If you Google Agenda for Change Salary Scheme, you'll be able to read more about what each of these bands mean. But just to situate this, band 6, a nurse, a fresh graduate in nursing would be employed at band 5 level, and after 3 years would be eligible for promotion to band 6. Just so we understand what level band 6 is. And at that level, they'll be expected to have some managerial duties, like they'll be managing junior nurses, the new graduates, band 5. So it's up to the applicant, whatever their background, to be able to say, this is where the 24 months I'm putting in to meet this criteria. I was working at so level, and this is why it is equivalent or higher than band 6 in the UK. And then the last point is you need to be able to prove that you have 3 months out of that 24 months has not been more than 3.5 years ago. So that means your 24 months could be as far back as 3 years, 4 years, as long as at least 3 months of that is not more than 3.5 years ago. I'll give an example. I know this can sometimes be complex, so I've put an example just so we can understand it better. So if a nurse from Nigeria is wanting to apply for this specialty training, they're not good. I don't think they give. Is there any nurse here? There's somebody that said non-medical background, not medicine degree. Sorry. Are you a nurse, please?
No, a
No. Okay.
dietitian.
Did you say dietitian?
Mm-hmm.
Okay. Kalu might know some things about this. So if I've put or if I'm saying something wrong, please correct me, Kalu. So you need to be registered with. Yes.
Go ahead, please.
Okay, so you need to be registered with the nursing council. That's how you fulfill this first criteria. Let's go back to that. Sorry. That's how you fulfill the first bullet points there. That's the last part where it says registered to practice healthcare. So you need to be registered with the nursing council. Then you need 48 months of any paid experience. Second bullet, 20. So this is this nurse now explaining that she has 24 months experience at Con S10 level, which by salary structure is what would be equivalent to a band 6 in the UK, or SNO level. Again, it's up to the applicants that has put in the application. You might not have been on Con S10, you might have been on Con S9, but you're doing the duties of somebody that is on Con S10. If you're able to explain that, you could get shortlisted, as long as you explain properly that your duties, your role are equivalent to what a band 6 in the UK would do. And then for the 3 months part, it means you're saying you have 24 months experience at this level, but 3 months of that has to be from 2022 February. So if you put 24 months experience between 2018 and 2020, for example, and from 2020 to date, you have not worked in that public health role at that level, you will not be eligible. And I've put in caps here again. You need to explain the relevance of your work to public health. For example, this person is a nurse in maybe pediatrics department. You need to be able to say things like, in your work as an SNO, or in your work in so level in the pediatrics department, you were involved in health education, giving parents information about immunization, giving parents information about breastfeeding. All those are relevant to public health. And how you explain this is going to determine if they confirm your eligibility or not. And I already talked about this band 6 level. The emphasis is on the duties. They expect that you have some level of seniority, you have some management and leadership experience. It's not necessarily the salary. The salary can be an added advantage if you already have experience at CONES 10 level. Yes, then you need to mention that. But if your salary does not meet that level, it's up to you to show that my roles, my duty at this level was equivalent to a band 6 in the UK. So again, another quick poll just for me to confirm we are all following and understand. Can we quickly get on Mentimeter again and answer this question? Which of these persons will not be eligible? Which of these persons will not pass stage 1 based on the information given here? Any more responses? Are some people not sure what the answer is? Okay, one or two more responses to go. Okay, is anybody confident enough to explain the reason why everybody has chosen that is the 2024 medical graduate? Is anybody happy to quickly explain, and then we'll go on to the next slide? Hello?
Yeah, we are with you. I want to give other people a chance to talk at least.
Is somebody willing to tell us why they've chosen the medical graduate?
Because we need to just before the start date of the thing.
Sorry, I can't hear you clearly.
You need 2 years work experience before the start date of training.
Yeah, and somebody that's graduated in 2024 is not likely to have that by August 2025. So straightforward. The physiotherapist, if you have 5 years experience, already meets that 48 months, which is 4 years. If they've been working with the elderly, they'll be able to explain that they've done some work on falls prevention, which is relevant to public health. And if they've been working for 5 years, they're likely to have moved on to seniority level equivalent to band 6, similar to the mathematics graduate that is doing data analysis in Ministry of Health. Can explain how the analysis that it does with Ministry of Health is relevant to public health. And if they're senior data analysts, then they're likely to be able to explain that they've met band 6. Okay. A quick drill. Let me just jiggle up your mathematics and see how ready you are for assessment center. So again, using Mentimeter, I think this one, it will allow you to drag a dot to where you want it to be. Which one is the smallest number? Which one is the biggest number? Which one is in the middle? In the numeric part of the assessment center, if you're spending this amount of time to answer this question, you're not likely to finish. I'm waiting for more responses. Anybody still answering? I'm not sure I can see how many people have responded in this slide. But yeah, I think this is correct if it's one person or everybody. Okay, I think now I can see. That means only one person had responded before. Is anybody still answering? Are you happy for me to move on? Hello?
You can move on, please.
Okay, so you'd have questions like this. This is was just a slide to give you an idea of what the assessment center numeric part might look like. So stage 2 is the assessment center. The center here does not mean you're going to a physical place. It just means the stage. It's not a physical venue, and it's computer based. It's delivered by Pearson. Pearson does a lot of exams for different organizations. I'm sure you must have heard of them. And it can be done anywhere in the world. I think there's at least 2 centers in Nigeria. And there are 3 parts, like I mentioned earlier. That's the numeric one, which is called RANRA. That's just the name. It's Rust Advanced Numerical Reasoning Assessments. There's a critical reasoning one, and there's the situational judgment. So for the RANRA, the numeric one, you have 32 questions over 40 minutes, and it tests a wide range of your mathematics skills. You have questions on rates, ratios, fractions, percentages, simple and compound interest, raised to power, lots of decimals. And so 32 questions in 40 minutes invariably means you should be spending about 1 minute per question. If you go on Mentimeter, you'll be able to see this picture, the full picture of this. It's just a sample of how the questions in RANRA would look like. And at the end, there's a link to the Pearson's guide and sample questions that you can use to practice. There are other practice materials as well that we can talk about during the question and answer session. And then there's the Watson-Glaser, the critical assessment one. It's called Watson-Glaser. That's probably the person that designed the test. This one, you have 40 questions over 30 minutes, and they'll be asking you, it's just like a test of English and verbal reasoning. That's what we are more familiar with the term. They'll ask you to make inferences from some statements. They will ask you if a statement makes an assumption or not. They'll ask you to deduce your own interpretations, and then they'll also ask you to evaluate if an argument is strong or weak from statements that you'll be provided with. And then the last part of the psychometric test is the public health situational judgment. You have 53 questions over 100 minutes, and the questions would just assess your skills, how you're going to react in different public health situations, at work, on the field. Again, if you go on the Mentimeter, you'll be able to see the sample question there, and at the end, I'm going to share links where you can see more questions and what you can use to practice. There was an analysis of the public health recruitment process for I think there was one for 2018 to 2020, and there was another analysis, published articles for 2021. And from there, usually the pass rate was highest for RANRA, followed by Watson-Glaser, and then followed by this public health situational judgment test. Then the final stage, which is the selection center, it's interviews like I mentioned earlier, and they'll test all these skills in a few questions. So it's up to you to start preparing how you're going to tailor your answers to show that you have the technical skills. Do you have public health knowledge, public health skills, research, personal skills particularly? They're very important because most people will tend to forget most of them. And if you check the person specifications, which is already published, they've listed the personal skills that they're interested in. So time management, teamwork, and all your answers. They will not ask you, tell us about your technical skills or tell us about your academic skills. They'll ask you real life questions, and you're supposed to show that you have all these skills from your answer. Probity is professional integrity. Except if you say something ridiculous during the interview, you're not likely to lose marks for this. And then commitment to specialty also. They will not ask you, how can you prove that you're committed to public health? Again, this needs to show from your answers, telling them about how you have shown that you're actually interested. What have you done in relation to public health? What are your hopes? That also talks about commitments when you start to talk about what you intend to do with the training, in the training, and with the training. Okay, and then the format of this selection center, it's virtual again, so you can do it from anywhere in the world. So all of this, the whole application process can be done from outside the UK. You don't have to be in the UK. There will be 2 interview sessions, and this could last between 6 to 8 minutes. Before last year, it used to be 8 minutes for each question. Not each session, sorry, for each question. But last year it was 6 minutes for each question. The publication this year said this for next year is likely to be similar to the last one. But again, they might revert back to how it used to be previously. So it could be somewhere between 6 to 8 minutes for each question. You have 2 or 3 panelists. Again, it used to be 3 panelists per session before last year. They reduced to 2 panelists per session last year. This year, we're still not sure if they're going to continue with 2 or would go back to 3. And then for each session, you have 2 to 3 as well. So if it's 2 panelists interviewing you, then you have 2 questions in each session. And if it's 3 panelists, you have 3 questions. So that means you either have 4 questions overall or 6. If you have 4 questions, you have two panelists per session. And on the other hand, if you have 6 questions, you have 3 panelists per session, and they're all going to score you for all the questions. And then you have 1 or 2 questions. So if you're doing 4 questions overall, then you're likely going to have 1 question given to you 24 hours before the interview. And if you're doing 6 questions, you're likely going to have 2 questions given to you before the interview, 24 hours before, so you can prepare. And then you'd usually start your interview with the question that you've prepared for. I think that helps people to at least be comfortable, start on a comfortable level with the interviews. If it's something you're prepared for earlier, then it helps you to get rid of some of the nerves. Okay, so that's all the stages for the application process. The timelines for next year has already been published. Applications are going to open on the 24th of October and close 21st of November, which is typical. They're usually open for about a month around that time. Then booking for the assessment center, that's after they've checked eligibility, they will confirm that you're eligible or not. And then the booking for the assessment center will then open 18th of December. Assessment center is usually done over 2 days. For next year, it will be 7th and 8th of January. So that's just about 2-3 weeks after they tell you that you're eligible. And it's usually better to already start to prepare before you get that, because 2 to 3 weeks is not likely to be enough for most people. I've seen a few people that said they prepared for the assessment center in 2 weeks, but most people prepare over 1 to 3 months. So once you put in your application, you should ideally start to prepare for assessment center. The result for assessment center usually comes about 4 to 5 weeks after the assessment center is done. And once you get the results, you have about 2 weeks again for selection center. And then, so that would usually be around end of February, first week of March. And then they'll give the initial offers as the first set of people. So the way it goes is they give offers out based on the preferences that you have. I'll talk about preferences soon. The preferences that you have chosen. And some people would reject the offers because they don't want the location they've been given. Some people have applied for several specialties and they've decided not to take public health. So some of those offers will be rejected, and then they will recycle and offer the ones that have been rejected to other people. So that's why this says initial offers. Subsequent offers will continue to go like that until all the spaces are filled. And sometimes that can go until May, June. In fact, I think I've heard of situations where people got offered to start in end of July, so about one or 2 weeks before the program was supposed to start. It just depends on people accepting or rejecting. Some people accept and then eventually change their minds and reject it, and so some late offers might come. So about preferences, like I mentioned earlier, the training is national, or the recruitment is national, sorry. Your training will be in a particular region. They'll ask you to rank all the regions in the United Kingdom, including Wales, Scotland, Northern Ireland, according to your preference. Your performance, so that means if you perform very well, you're likely to get your high ranking regions. If you pass both stages, but you're not ranked highly amongst everybody that passed, then you're likely to get lower down in your preferences. But I believe everybody here is from Nigeria. For those of us from Nigeria or from other countries, I think it's the preference ranking is an advantage because we're not really tied to any part of the United Kingdom. You can rank all the regions. There's no restriction on how many you can rank. You can rank all the regions. Most people in the United Kingdom, like their own graduates, will probably rank just regions around where they already live. Some of them have families, some of them have bought houses in a particular place, and they don't want to travel 8 hours away for training. So that leaves us with an advantage of being able to pick any region possible. So I always tell people, be flexible in your preferences. I ranked every single preference when I applied for the training program. I ranked every single region, Even Northern Ireland, Scotland, and Wales, which are 8 hours away, most of them from where I was living. So some things people consider in determining where they rank high and where they rank lower down. Their family. Some people are already in the United Kingdom before they apply. Maybe you're married, your wife is already working in a particular place. You want to consider that before ranking. Obviously, if your wife is working in this city or this region, you want to rank that region high and probably rank neighboring regions higher than somewhere very far away, or vice versa if you're the wife and your husband, or even if you have siblings around there. Community, very important. So siblings, friends, if you have people in the UK already, you want to tailor your ranking around those so that you have that support around you during training. What else? So again, when they publish the competition ratios, the one for last year has not been published yet, but they always publish the competition for each region. And usually London is the most competitive. Everybody wants to go to London. So when I ranked my preferences, I put London lower down below. It just gives you an advantage of that place is very competitive. There's probably, I can't remember how many slots used to be for London, but a lot of people apply or put London as one of their high ranking places, and that makes it a lot more competitive than other places. On the website, on the training website, Faculty of Public Health website, you should find links to the different regions and where, because during the training, you're going to be rotating different places. It's not hospital based like other specialties. You're going to be moving to different organizations. And because it's regional based, some of the regions are very large. Some of your placements might be very far from each other, and it can be quite difficult choosing a central place to live in. So that's something that some people also consider in deciding where they rank high. Some regions like Yorkshire are very big, and if you might decide to stay in, say, Leeds, for example, but some of your training placements will be 2 hours away and you have to go to work. Though there's lots of remote working opportunities in public health training, but sometimes you'd have to travel that distance. So you want to think about that to rank which regions you want to put high and which ones you want to put low. Another thing people think about is the universities. I mentioned earlier there's an MPH that comes with your training. For most regions, the MPH is done in the first year of training. I think there's a few regions that do the MPH in the second year. But some people think about the prestige of the university that that region uses to decide which ones they rank high or low. And then preparation, I'm not going to dwell very much on this now because I know Carlo has done videos on the different stages on how to prepare, and I can answer lots of questions on preparation in the Q&A part. So you need to start now, really. If application is opening next month and the assessment center is going to be early January, that means if you need 3 months to prepare, then you're almost at the start of 3 months from now. For the assessment center, really practice the different tests. There are lots of different resources to practice online, and the most popular resource for assessment center is Job Test Prep. I'll share the link during the Q&A session for those that don't already have it. For the selection center, you just need to bury yourself in public health related things. First, you need to digest that person specifications to know the skills that you're going to be tested on, all the things that you need to prove. Then you need to read public health, listen to public health. Like I said here, in fact, you need to eat public health to prepare for that. So there are different sources you can use. It's best to just use a combination of all of this. Read blogs, listen to podcasts, read public health news. There's 1 or 2 books on public health. If you know people in the training or consultants, get one-to-one sessions. Just talk to them about your interests. How can you improve your chances of getting in during the interview? Most regions organize taster sessions where they bring consultants and residents in that region to talk about the training. And then some regions do what they call a shadowing week, where you join teams of public health registrars and see what they do throughout the week. You're invariably working with them, just observing what they do. And then there's social networks you can join as well, like this mentorship program. I think there might be some Facebook groups as well. When I did my preparation, there's the students. I think the student network is like a social chat group, and I'll share the links later as well. So it's similar to Nairaland. There was a thread on public health specialty application for that year, and people come with all sorts of information on how to prepare. So those can be good as well for preparation. So I just want to end with this quote, because competition ratios can be scary, and it's one of the things that you see a lot. People will talk about a lot. Some people might try to discourage you, like they try to discourage me because of competition ratio, and just tell you go and do GP. That's what everybody is doing. To be fair, if you try, you risk failure. But if you don't try at all, you're just going to ensure that you fail, because if you don't try, you're never going to get it. And another quote: if you never try, you're not going to know what you're capable of doing. Forget about the competition ratio. It's competitive, but people get in, and you can get into. Thank you for listening. These are some of the links. I might be sharing some more in the group later.
Okay, so the floor is now open for comments, contribution, questions, anything that anybody has. Please feel free to come forward. I will start with my question. So, like for the medical routes, GMC registration, is it must? And if it is must, you need an up-to-date license before you start the training?
Yes, it's compulsory. If you don't have GMC registration, you won't pass the stage 1. They'll just come back and tell you you're not eligible. And yes, you have to have a license to practice as well.
Before you start, just like any other clinical specialty.
Yes.
Okay.
But
Thank you.
something I didn't mention, even as a doctor, you can apply through the non-medical route if you meet all the criteria for the non-medical route.
Okay. That's really good. So please, any other person that has any question, you can go ahead and ask.
Hi, Dr. Afolabi. Thank you for the session. I was going to ask a question as regards sponsorship. So let's say you're in the UK, you're working as a non-medic. So obviously you already have your COS. If you are going to change route, let's say you get picked into this specialty training, would the public health specialty training program sponsor you, like give you a certificate of sponsorship?
Yes, they do sponsor you for the entire duration of the training.
Okay, that's good to know. Also, how about if you have like a master's degree from Nigeria already? Does that shorten the length of your program, or you still have to do like another master's? Like, is the master's degree in Nigeria recognized in the UK?
Do you mean an MPH?
Yeah, master's degree in public health.
Okay, so that is usually dependent on the region. For most regions, you're able to shorten your training program a bit, but it also depends on the content of the master's program that you have done. They compare it with what they expect you to learn from the MPH here, and if there are any modules that they see that is missing from what you have done before, then they'll advise you to do those modules. If the modules that they think you need to do are quite a number, then they'll advise you to do the entire MPH program over again.
Okay, so that assessment, what happens? Is it that during the I've not looked at the application form yet. If you put in that you have a master's, would they ask you to like upload your transcript, or what happens to make that assessment, like you said, to compare?
So remember I said the master's and the duration of the program is based on the region.
Mm-hmm.
Throughout the application process, everything you're doing is still at the national level. They're not going to be able to access that at that point.
Okay.
it's after you have passed through all the stages and then you're given an offer in a region that your region would now look at your MPH and determine if they want you to do extra modules or they want you to do the entire masters. And they'll also let you know if they're able to shorten your training if they accept your masters,
Okay, that
or
makes
if,
sense.
yeah, do you understand?
Yeah, and another question. Sorry, my questions are too much.
It's
So
all
let's
right.
say that for
It's a
your
Q&A
masters,
session.
you don't have like your certificate, but you have like a statement of results. Does that work?
I don't know the details of what they check with the different regions.
Well, I mean at
Um,
the assessment when you are doing your application, rather.
when you're doing your application, it doesn't matter if you have a master's or not, except
Okay.
if you're applying through the non-medical route and that
Yeah.
master's is what you're, is that what you're talking about?
Yes. Yes. Non-medical
Oh, okay.
route.
Okay, so if you're applying through the non-medical route and you have an MPH,
Hmm.
I'm not sure if they accept statement of result or transcripts. I can ask for you. Carl, do you know?
I don't know actually, but I think that most times um, they usually will not ask you to upload your results. But if they do, it's likely going to be maybe your certificates to say you've done that, because I know for doctors you are expected to upload your quest form. So it might just be the certificate to say you've done your masters. Um, that's it. But if you have a BSc and it's second class upper, I don't think you really have any competitive advantage by presenting a master's. So, except if there's a problem with your first degree,
No,
that
first
a
degree is fine.
master's.
Second degree is also fine. It's just because I don't have my certificate. It's not available yet. It's not ready. So it's just statement of result I have. But yeah, first degree
Sorry,
is
what's your
also
first
fine.
degree? Is it
Telecommunication
the
business
dietitian? Okay, yeah.
administration. Yeah.
Okay.
Yeah, so the criteria is there that you need to have a good first degree.
Hmm.
So once you have it and you've got your certificate that shows, if they ask you to upload that in your Oriel platform or dashboard, they are not going to really prioritize someone who had a PhD over you, because they have
Okay.
stated that as long as you've got the relevant results they want you to get, that's fine. So you will be longlisted. If other essential criteria, you've met them, you'll be longlisted.
Okay. Okay. Thank you.
You're welcome.
Okay, thank you so much for your question and the answers from our chiefs. So any other person that has any question to ask, again, please feel free to come forward.
Yeah, thank you so much, Dr. Kayode and Dr. Carlo for organizing this program. It's really, really very interesting, and personally, I've learned a lot, something that will actually help me with the application process. But I have some concern, which is just personal. Personally, I have a gap in clinical practice, which is about 18 months, beginning early last month to August this year. So I don't know if that is going to affect my application. Do I have more than the 3 years and a half of clinical practice overall? So I don't know the recent gap in clinical practice, whether it is going to affect me in any way.
Okay, so if I get you well, you were practicing up until early last year.
Yes.
So what you need to fulfill is you need somebody to sign a form. The clinical experience needs to be between February 2022. As long as you have up to 3 months after February 2022, that's fine. So if you continue to early last year, that's 2023, early 2023. So you should have at least 12 months in that period. So that shouldn't be a problem.
Okay, that's fine.
Do you understand?
Yes, I do.
Yeah.
And again, your consultant signing your CREST form doesn't have to be a UK consultant. It could be your consultant from any other country. But usually they would now add their registration, their professional registration number, or things that will identify them as consultants, so that if um, the recruitment center, if they want to check, they can always find out whether it was a consultant that signed it for you.
Okay, thank you very much.
Also, just to emphasize, I think if you're in the UK already and you have clinical experience that meets that criteria, I mean, within 3.5 years from Nigeria, it's usually better to get somebody from Nigeria to sign it. Most consultants in the UK, from the experiences of other people I've heard, they're always reluctant to sign that for you if you didn't train here, if you didn't do your house job or foundation here. So if you're able to sign it from Nigeria, it's usually better. If you're signing it from Nigeria, you need to make sure the person that is signing it for you has their annual license to practice, and they also have proof to show that they're on the register for consultants. My first CREST, because I submitted 2 CRESTs, the first one was rejected because the consultant that signed it, only attached a receipt that he has paid for license, but he did not follow up to collect the license, so he didn't have the license and they rejected it. Luckily, they gave me another chance to upload a CREST form. I think they gave me 2 or 3 days deadline. That means if I did not upload an acceptable CREST form within that period, they would reject my application. That they'll confirm ineligible. So you need to make sure, because I know the way MDCN is in Nigeria now, many people don't collect their license anymore. They just pay and keep the receipt. That's not going to be acceptable if that's what you're using for the CREST form.
All right, thank you very much.
Thank you, Dr. Kayode and Kalu. My question is, after the assessment center and then the interviews, what's the criteria for ranking? Would it just be the interviews, or it's your marks combined from the assessment center and the interviews?
So before last year, they used to combine both the assessment center and the selection center, your scores from both, and use that to rank. And it used to be 40% of your score from assessment center plus 60% of your score in the interview, the selection center. But last year, they changed that and only used the selection center to rank.
Okay, and are we expecting the same for this year?
So the only thing they've said so far is on the page where they put the advert. They've said the process for this year is likely to be similar to last year. They did not publish the reason why they changed it last year. I'm only assuming they changed it because people have commented and complained a lot about how people from medical background tend to do better in the assessment center than people from non-medical background. So probably they changed it trying to make it fairer, if that's the best word to use, to everybody.
Okay.
So that
and then,
they only use the assessment center to shortlist for selection center, and then everybody is on level ground after that again.
Okay, and then for the selection center, just because it's an interview, unlike the assessment center where maybe its questions is a bit more objective, is there any strategies to it? How to do well in that?
So apart from just getting as much knowledge as you can and practicing your answers to potential questions that would address the person's specification. I think the other thing you need to work on is your presentation skills, your
Okay.
communication. I don't have any sources, and the articles that were published did not, I don't think they had, apart from talking about being the first language and that affecting, they only said that that could affect the critical reasoning. But I think the accent and English not being our first language might be a disadvantage, and it's something you might want to work on, because if they don't hear you, they can't score you well.
Okay.
So yep, if you want me to just emphasize the tips I put in the slides again, where there's lots of different people writing. There's the president of Faculty of Public Health always publishes random things about public health on his Instagram, on his LinkedIn. You can follow him. There's I think there's lots of other people. Public health news. If you just keep googling public health in UK, there's the Health Security Agency, UKHSA. Let me just type these things in the group. If you check their website and just keep following any updates they have, all those will just give you general knowledge of public health in the UK. And wherever the question goes, you can slot those things in, or the knowledge you get from there can just be what you need to answer their interview questions. So the more you know, the more likely the questions are going to serve into your hands, really.
Okay. And then lastly, just as a, means of maintaining contact with yourself and Dr. Kalu, is there a way to reach out even after this meeting if we have some further questions or things to discuss?
Are you on the platform?
Yes, the Telegram, yes.
Yeah, so it's a good way to communicate with us.
Okay.
You can post questions in the different thematic areas and we will try to respond. So maybe let me go ahead of myself. If I'm able to get the buy-in of Dr. Afolabi, that's Coyote, we might, closer to the time, do sort of, even if it is mock session or so, or revision for folks who are going to be doing the assessment center and the selection center, just to give you a flavor of what you might likely see, just to help folks to prepare and boost their chances. But those information will also be dropped in the Telegram group. So if you peel your eyes, you'll see some of those. And also try to be active there. If you've got any question, just ask there. Again, I don't know how feasible it is or whether it's obtainable, but I think that if you're coming through the non-medical routes, you might need to have evidence of English language tests. I mean, for the doctors who are going through the GMC route or the medical route, they have already been assessed and passed their IELTS to a certain degree. So part of what they stated on the website for the non-medical routes is that you need to have attained that same level of the GMC expectation. So which makes me think that there's a likelihood you should have written IELTS as well and scored highly as expected of someone who is going to be practicing within the GMC level. I don't know whether you've got anything to say to that.
Yes, definitely. I'm not sure I've seen it on the public health specialty training, but if you're coming from Nigeria, whatever route you're coming for, you need a test of English to prove that you can work in their country. So even if they don't ask at the public health specialty training level, they'll ask at your visa application level.
So what about someone for a non-medic that's been working in the UK that is already like a band 6 already, and you have your HCPC license to practice in the UK and you're working in the UK? Does that apply to you as well?
when you apply for HCPC, do you need to show proof of English language?
Yep.
Yeah, so you don't need to have a new IELTS as long as you're able to. If you check the visa and immigration page, it's stated there those that need to do the English test or not.
Yeah.
If you use the English test to get your professional registration, then you don't need to do another one.
Yeah. Then I was going to ask again, like if you're already into the training, if you like how many non-med what's the successful what's the question now? What's the for non-medic
Success rate for
what's the
non-medics.
yeah.
So generally, over time, it's been medics do better at assessment center, non-medics do better at selection center, because obviously you saw the eligibility criteria. They need to have worked in public health for at least 2 years, or public health related roles for at least 2 years, which the non-medics don't have to have. So they're likely to know more in public health, and that's why they tend to do better from the analysis of those published articles. So I think one of the links is in the slides. I'll share the slides later on. So
Yeah, but like
eventually they say it's about 50-50
oh,
getting in. Yeah.
but where you are now, would you say it's true, like it's 50-50, if you don't mind?
In the entire training program, it looks like 50-50 in the region where I am.
Oh,
For this
nice.
particular year, I started this year. It's a lot more medics, but generally it's about 50-50.
Okay. Thank you.
So the other thing I would add, it's if you are in doubt of anything at all, you can always send a mail to their designated email address to ask for clarification. They will come through to respond to you. Don't assume anything. For instance, if the English test you used, you're not sure whether it can get you into the public health training, email the team to say, these are my concerns. Am I eligible to use this? So that it helps you to prepare ahead of time. Because I also know that different professions have different English requirements. And I reckon that GMC, their own standard is so high that if you need to get at least 7.5 overall and 7 for each band. That's, I mean, in IELTS. So if that's what they are using, then you might need to check whether it's the same level with your own professional registration. But if in doubt, please email the Public Health National Recruitment Team and they will respond to you.
All right, thank you.
Okay, thank you.
Just
Okay,
sorry,
go ahead, please.
let me quickly add to that. When you email for clarifications or questions, always make sure you have checked whatever is published online and be armed with the information, because sometimes people coming from different scenarios they're not used to, they themselves, whoever is answering or handling this thing, might not have all the information. If you let them know what you have seen and you want to clarify, you want to ask questions, because even for me with my GMC registration, somebody emailed me to ask for proof of English tests in the last 2 years, or is it 3 years they use now? I was the one that now had to reply. I took a screenshot of the part on gov.uk where it says with GMC registration you don't need to prove your knowledge of English, and sent to the person. So just make sure you have, if you have any information online, you're also from especially gov.uk, share with them when you're asking for clarifications. So somebody's not telling you wrong and then discouraging you or stopping you from going ahead when the person actually doesn't have the right information.
All right, thank you so much.
And you can always call them. There are lines that you can call, particularly if you're within the UK. You can always call and they are there to respond to your questions. Don't be afraid to seek for clarification. It's better you ask than not.
Thank you so much, Dr. Kayode, for the response. Just one last question. I was just wondering. I know you said all we need to do is try, but realistically, what are our chances? Coming from Nigeria, and then applying with all these people, and yes, it's the most competitive specialty to apply for. Just realistically, how likely are we to get this?
Hey, can I answer this question, please, if you
Yes,
don't
go
mind?
on. We can both answer. Go on, answer first, then I can also say something.
Okay, so there are no guarantees actually, even for the guys who are British or UK citizens. The exams are not also easy for them. People do write these exams multiple times. So, like Kayode mentioned while he was discussing, you improve your chances by practicing. And why we have put up this platform is to help people discover what they need to do. Prior to this time, nobody really knew where to go to, what to use. But now we are trying to democratize the information so that you can have a competitive advantage, or you can have equal footing with anybody who is based in the UK and you're not based in the UK. So the the material that he's talked about, the job test prep and other things, would help you. But the bulk of what you need to do is actually practicing, working hard and practicing on that, and looking for people who are also preparing. Like, if you look through the list of the people who are in this call, you can get in touch with them personally and plan discussions, plan how you're going to be preparing. I know you might be working in a busy schedule or something like that. If you give yourself 30 minutes, 1 hour each day or so, preparing, discussing, some of these things become familiar. But if you leave it towards the exam period, then you're likely not going to do well. So, Kayode, I yield the floor to you.
Okay, so I'm just quickly going to use the numbers. They're not published yet. It's probably assumption based on feedback from the different stages, and on that group I said I was, and also from some presentation from one of the leaders in the school recently. So I think about 1,600 people applied last year, and then about 1,300 were found eligible. Then that means 1,300 did the assessment center. About 260 were deemed to have passed the assessment center and could go on to selection center. And from about 260, about 170 something passed the selection center, but there were only about 100 spaces. So from those numbers, you can tell that the biggest rate limiting step is the assessment center, because they cut down from about 1,300 to about 260. If you use job test prep to prepare, you're able to tell how much more preparation you need, because job test prep is going to tell you your performance in your practices compared to other people that are practicing with the same site. So it's going to tell you you did better than so percent of people, or you did better than, well, it will just tell you did better than so percentage of people. I usually say you need to be at least above 80% in all your practice tests. In fact, 90% should be your target. If you're not doing more than 90% of the people taking the test, then you need to beef up your practice. So that way you are realistically able to gauge yourself. But obviously you're already in the process at that point. You've already been longlisted for assessment center. But the fact that that is there can help you improve on your practice for the assessment center. Once you go through assessment center, you've done more than half of the job. And the fact that you have people myself and Kalu here today talking to you about this means it's realistic, you can get in. But we will not tell you it's not difficult. Yes, it's difficult, and the numbers say that.
Thank you so much for that. That's quite helpful.
You're welcome.
Okay, thank you. Thank you, everyone. This has really been interactive. So please, does anyone have any question to ask again? Any more questions?
Hello?
Okay, go
Hello.
ahead, please.
Yeah, sorry, can you just throw more light on this academic, is it clinical fellow, public, or is it academic clinical fellow? I'm not sure exactly the um
Okay, we will talk about that in a different section. So,
okay,
but
thank
it just means that an academic clinical fellow has a specialty training time and also a research training time. So it's a public health registrar or registrar of any specialty in medicine that has an additional research training slot. So we'll discuss that in a different setting, not in this one. Thank you.
Okay, thank you. Just one more question. I know I've seen a couple of SJT questions, public health, and it's a bit different from the normal MSR exam people, right? Is there any material in particular that could help, like for those that don't have UK public health experience, something to help familiarize with such questions like MSR has some books available on SJT, but I've not seen any on public health really. Thank you.
Have you tried to subscribe to Job Test Prep? You would see one of the things you will go through there would be the situational judgment test there. And also, I shared a document in the Telegram group on public health practice framework, which is also very important to know your expectations, what we're expecting you to do as a public health practitioner. Some of those things are going to be what you will be expected to respond to in your situational judgment tests. And also, Kayode had mentioned that you need to get abreast with the person specification. So each of those 3 stages of exam or 3 stages of application would try to check those eligibilities, person specifications that they have asked for. Your application will take care of some of them. The assessment center will take care of some of them, and the selection center will take care of some of them. So it will be very good if you take out time and go through properly the person specification and even map those out to specific things that you're expected to do in the different stages of the application. That will really be helpful. Kayode, do you want to add anything?
No, I think you've covered it all. For me, I used Job Test Prep, and that was enough for my preparation for SJT. So
Okay, thank you very much.
Okay, thank you so much. And yes, I think it's there somewhere, but if you can please have again the list of the materials to use for preparation and which one is like the must do. And for those that are preparing for this year, I'm also preparing. So there is need for us to have like a mini group where we can help each other. Okay, so I will talk in the larger group. So any other questions? If not, I will hand over to the boss.
All right. Thank you very much. Dr. Kayode, thank you so much for your efforts today. It's been quite interactive, like someone had already mentioned. So a bit of announcements. Thank you for coming today. We'll continue other processes from the Telegram group. Remember that our goal is that as many as within the group and want to go into the training, that will support you through that process. As we share materials, please engage with them. Also ask questions. Don't think anyone is a stupid question or silly question. Just ask and we'll try and do our best. And like I mentioned before, if we've got the time and the capacity, we will be able to organize a mini sort of revision for folks who are preparing for the application and assessment center and interview, just to give you a bit of extra support. Our desire is that more people would join the training in 2025 August. So thank you for coming.